Okay, I have verified the doctor's orders and I have gathered my supplies. Hello, my name is Frances. I'm going to be your student nurse today. Wash my hands. Can you please tell me your name, date of birth, and if you're allergic to anything? And I have compared it to the MAR and the hospital bracelet, and they all match up. Okay, upon looking at Miss Fitzgerald, I can tell that she is having problems with breathing, and she has yellow, scant, thick secretions coming from her trach. So we're going to go ahead and initiate the trach sectioning. But first, I'm going to go ahead and let her know that we're going to be doing assessment. So I'm going to go ahead and raise the bed to a good body mechanic. I'm going to put the patient in a high Fowler or semi-Fowler position. I'm going to go ahead and start the assessment by checking her O2 so I know what her normal or what it's running right now because it's been low. And then I'm going to go ahead and listen to her breath sound or her lung sounds. Okay, it sounds a little wet and frothy, so we're going to go ahead and continue with the trach sectioning. Do you have any questions so far, Ms. Fitzgerald? Okay, I'm going to go ahead and hyperoxygenate her by placing the mask directly over the trach, and I'm going to turn her oxygen to 100, and I'm going to leave it there for 30 seconds to 3 minutes prior to me sectioning. I'm going to also turn the section between 80 and 120. Wash my hands. Okay, I'm going to go ahead and make sure that my solution is not expired and it looks good. Okay, wash my hands. I'm going to go ahead and sterile gloves. Okay. Okay, I'm going to go ahead and hook up the tubing. Okay, I'm going to go ahead and test that the suction is where I need it. So I'm just going to, without touching the center or the sides or the bottom, the plastic inside where it's sterile. Okay, it's sectioning good. Okay, I'm going to remove her mask. I'm going to tell her this is going to be just a little bit uncomfortable. It's going to make her cough. I'm going to feed it with my fingers until I make resistance or patient coughs. And she is coughing, so I'm going to pull out with immediate suction. Okay. At this time, I'm going to go ahead and put this back on her for oxygen. Go ahead and check the O2, which is still not where I want it. And I'm going to go ahead and listen to her lung sounds again. Still not where I want them. They're still not clear to me. So therefore, I'm going to do a second suction. But before, I'm going to go ahead and clean my sectioning tube. Okay, and then I'm going to remove her mask. I'm going to go in till I make resistance till she coughs. Okay, she is coughing, so I'm going to go ahead and pull out. Okay, I'm going to go ahead and check her O2s again. It has come up. I'm going to do her lung sounds again, interior lung sounds again. They sound clear, so I am happy with it. I'm going to go ahead and put this back on so she can oxygenate while I clean my mess up. Okay, I'm going to do that. I'm going to do this. I hope I'm done because it's really good. Alrighty. I'm going to wash my hands. I'm going to clean up my mess here. I'm going to put her oxygen back down to what it was before, and the suctioning back down to what it was before. I'm going to lower the bed in the lowest position, give her her call light, make sure that she is comfortable, that she needs anything. And then I am going to document that the patient tolerated the trach suctioning well, that I saw a little mild yellow scant secretions, and that her chest sounds were beginning with a wet, frothy sound, that they were clear upon osculation after the second attempt of suctioning. Thank you.